Hi, this is Dr. Spencer Zimmerman. I help patients who are suffering from concussions get their lives back. So I want to talk about concussions and fatigue. If you've had a concussion or know others who have, one of the most common complaints you'll hear is just how tired they are. Often they'll wake up in the morning and be tired and just try to go through another day, but don't ever truly recover, or they'll make it till noon or 3 or 5, and then their energy starts going down and their symptoms start getting worse, like headaches, neck pain, brain fog, mood, word finding, and so forth. Now, let's talk about a couple strategies that can be used to help with the fatigue that occurs. So it's first important to understand that fatigue is, and actually the energy production is, an issue that occurs with concussions, and it's actually a safety mechanism that our brain does. The problem is that it works against us and gives us all of these unpleasant symptoms that we really don't want. So I want you to imagine that you've got a full tank of gas that you're used to having to do things with. Well, take a concussion, you're now down to about half a tank of gas, which means if you try to do as much as you could with half a tank as a full tank, right? Is that going to happen? No, of course not. It's not even possible. It can't bring you as far. And our brain is no different. So if you start getting those symptoms, it means you're pushing through what you need to, and you need to back off. So one of the number one things is to respect your brain. If you start getting symptoms, to back off what you're doing to recover, because the more you go through that, the faster you're burning through that fuel, and it's not going to replenish. And if you've got a really bad concussion, it's not only going to hit you that day, but it's going to weigh you down for at least a few days. So one, respect it. Number two, there's a way to exercise to build up. Now first, you shouldn't have many symptoms if you are exercising, and if you do have symptoms and you are, make sure you're not increasing your symptoms as you're doing it. If you are, once again, you are making yourself worse. And so what you really want to do is start exercising. I like stationary bikes because it's not going to impact your neck and other things as much as, let's say, an elliptical or even a treadmill would. But you want to be able to just go nice and light, because whenever you drive, the blood flow and oxygen to your brain, physical exercise is also great in helping our brain to reconnect and to heal and recover. And so you want to make sure you can tolerate it. Let's say you do 10 minutes and that gives you symptoms, back up to the 8-minute mark. And you want to build up stability there. As you can do that, you can then add more time. So 1, respect your brain. 2, physical exercise. And then 3, well, as part of the energy crisis, our brain doesn't necessarily have all the supplies it needs. And so there's a dietary and a nutritional component of this. Because our brain doesn't do as well with the sugars, using like a ketogenic diet, making sure you're getting lots of good fats and proteins, ketone-based supplements, but also there's supplements that have like acetyl L-carnitine, CoQ10, and other things like that that are also used by our cells to make energy. And so I hope those 3 things helped you. 1, respect your brain. 2, how to exercise to increase your energy levels. And 3, some of the supplements that can be taken and the ingredients to help you have more energy. So I hope this helped you. If it did, please give us a like, comment, share, or tag someone. Till next time.